Okay, so the next patient that you'll see, I forgot where she came from. Anyway, so she has a very flat tip and she has a very deep nasolabial angle. And interestingly, she has a frenulum that is holding her lip to the gums really tight. So I'm going to cut that frenulum right here and then develop the pocket for the TLC tip lift. Going right here, like a tent pole. So remember, the TLC tip lift is really good for projection, and it stands for translabial collumellar superstrut, TLC. So that's a TLC tip-plasty or TLC tip lift. And I'm also going to do a closed tip-plasty in her case, where I take some cartilages from in the nostrils. I will use that to give a little extra support underneath there, because she does have some, low-lying or posteriorly placed maxilla, and she could use some support in this area, or maybe just as a pedestal underneath right here, so for the long term it stays there, doesn't come down. Very good. Let's get to work. We got a lot of work to do. Here we are, lovely Nebraska ladies here, but guess what? Janjua Witness Protection Program. So good luck trying to figure out who this is. Anyway, let's take a look closely. So from the front you can see that she has bulbous tip, and she has nostrils that are borderline. They don't bother her, so they don't bother me. Now when you look from below, you can see the tip is flat, and she wants to raise it, and rightfully so. And that's what we are going to do. And then let's take a look from the side view. That is a critical issue right there. So you can see that there's no definition to the tip. It needs to be lifted up a little bit, and the nasolabial angle needs to be opened up right there. So we'll take a graft from the ear, and also we are going to do the tip-plasty to remove some of the lower lateral cartilage to achieve this effect. Not as much, but like this. If we can get this and the tip lifted, we are in good shape. And interestingly enough, she has a frenulum that is still attached, like the baby. See this? Right there. Right there. So we need to cut that. It's coming all the way down between the teeth. So very good. Okay, welcome to the TLC tip lift. TLC, translabial collumellar. That's why it's called TLC. TLC tip lift. We got the cartilage from the ear. We made it into a bilobed little leaf-like structure, closed it up, and put it in there. And we used the nasal cartilages, the lower lateral cartilages, to give a little bit more cushion, like a pedestal underneath, and that helps open up the nasolabial angle. Let's take a look. If you come down, please, Kim. So you can see the lifts right there. So if you look at this going this way, what a nice lift right here. And you can see the nasolabial angle wide open. Obviously there's a lot of local anesthesia as well. That'll settle down. It's all over. And eventually I think it's going to be more a little bit like little down like this. But she's going to have a good tip for a while. So here we are. TLC tip lift. Thank you. Okay, here we are. I'm so excited. It's wide open, the nasolabial angle. You can see the tip definition as well. And as we go over right here, take a look over there. That's the cartilage removed. And then as we come down, there we go. And that's a lot of swelling, but that'll settle down. So very happy about this. She's gonna like it. And this is gonna be her permanent fix. There we go. Beautiful, beautiful, beautiful. Let's have a few pictures and then we are done.